Now, in order to consider Amendment Number 13, printed in Part B of House Report 116-2. For what purpose does the gentleman from the Northern Mariana Islands seek recognition?
Madam Chair, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 13, printed in Part B of House Report number 116-2, offered by Mr. Sablan of the Northern Mariana Islands.
Pursuant to House Resolution 43, the gentleman from the Northern Mariana Islands, Mr. Sablan, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from the Northern Mariana Islands.
Thank you, Madam Chair. I rise today to offer an amendment that increases funding for the Marianas Medicaid Block Grant. Our islands were struck by 2 catastrophic weather events late last year. Typhoon Mangkhut made landfall September 10, and on September 29, the President declared a major disaster for the islands of Saipan, Tinian, and Rota. While recovery from Mangkhut was still ongoing, Super Typhoon U2, the second most powerful storm ever in United States history, struck. U2 caused widespread destruction of homes, businesses, public facilities, and infrastructures. On October 26, the President declared the second major disaster for our islands. U2 also brought death. Never in anyone's memory has typhoon caused death in our islands, but 1 person died during U2 and another in a storm-related accident. Over 130 people were injured. Our only hospital, which has just 75 beds, packed people into the emergency room to stitch up wounds, remove glass and flying debris from legs and arms and faces, and attend to those that needed dialysis or other treatment while waiting days for power to be restored. Medicaid provides 1/4 of the revenues for the hospital and health insurance for 30% of our population. But there's a cap on how much Medicaid funding is available to the Marianas. When a storm strikes, the program has to steal from tomorrow to pay for today. The disaster appropriation the House passed on December 21, generous though it was, provided no money for Medicaid for the Marianas. Chairman Lowy, recognizing the lapse, added $20 million in H.R. 268 for the Marianas Medicaid program to be available for the rest of the year. After her bill was drafted, however, the Centers for Medicare and Medicaid Services, CMS, informed appropriations staff that the Marianas can actually use $36 million in the wake of the typhoons. Following that advice from CMS, I'm offering an amendment that adds $16 million to the original bill, bringing total assistance for the rest of the year to the recommended $36 million. I ask my colleagues for their support of my amendment and of the underlying bill, H.R. 268, and I reserve the balance of my time.
The gentleman yields. The gentleman reserves. Does a member claim time in opposition to the amendment? Seeing none, the gentleman from the Northern Marianas.
Madam Chair, again, the $36 million I'm requesting by adding $16 million to the $20 million already in the bill is what CMS told Chairman Lowy's staff the Marianas can spend this year in the aftermath of Typhoon Mangkhut and Super Typhoon U2. And I'd like to ask for unanimous consent to insert into the record a recent news report from Something to Nothing in the Honolulu Cebu bid. And I yield back the balance of my time.
The gentleman's request will be covered under general leave.
I hold back. I yield 1 minute to the gentle lady from Connecticut.
The gentlewoman from Connecticut is recognized.
Thank you very much, Madam Chair. I rise in support of Mr. Sablan's amendment, and as chair of the Labor HHS Education Subcommittee, I believe we must ensure Americans can access vital health programs, especially in times of dire need. Yet after terrible typhoons, Americans in the Northern Marianas could see Medicaid run out. Unlike states, territories have finite pools of Medicaid funding. Centers for Medicare and Medicaid Services estimates the Northern Marianas need $36 million to maintain care for Medicaid patients, up from $20 million, which we provided in the underlying bill. Mr. Sablan's amendment would provide that additional $16 million. We have an obligation to help Americans in Middle Connecticut, and yes, the Northern Marianas access Medicaid as well, especially when they need it the most. So I strongly support the amendment and yield back.
Woman yields. The gentleman from Northern Marianas.
Madam Chair, I have no further statements to make. I yield back my time and I ask for support of my amendment on the underlying bill, H.R. 268.
Thank you. The question is on the amendment offered by the gentleman from the Northern Mariana Islands. Those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to. It is now in order to consider amendment number 14, printed in Part B of the House Report 116-2. For what purpose does the gentleman from the Northern Mariana Islands seek recognition?
Madam Chair, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 14, printed in Part B of House Report number 116-2, offered by Mr. Sablan of the Northern Mariana Islands.
Pursuant to House Resolution 43, the gentleman from the Northern Mariana Islands, Mr. Sablan, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from the Northern Marianas.
Madam Chair, my second amendment to this supplemental appropriation increases emergency food assistance for the Marianas. As I explained earlier, our islands were struck by not one, but 2 typhoons last year, one right after another. Typhoon Mangkhut and Super Typhoon Yutu, the second most powerful storm ever in U.S. history. While the first 30 days after Yutu, our local food stamp program had incurred costs of $10.2 million. That money helped families replace the food they lost in the storms when their homes lost roofs, water poured in, and electricity and refrigeration were cut off. Over 40,000 people out of our total population of 54,000 received help in that first month, according to the Department of Agriculture's Food and Nutrition Service. H.R. 268 replaces that first month's expenditure with an appropriation of $10.2 million. I thank Chairman Lowy for recognizing the need. But beyond that first month of emergency, more is needed. The Marianas is not part of the Supplemental Nutrition Assistance Program, SNAP. Instead, we receive a block grant from the federal government. With the block grant, there is no reserve, as with SNAP. When disaster strikes, not only is money used up faster than planned on the front end, future costs also rise until families get back on their feet. We have no official projection of the ongoing costs because agriculture employees are furloughed. But just before the lights went out, my staff learned that about 20% of the people who received food assistance right after the storm were expected to remain eligible. And if these projections hold true, those caseloads will double from 3,000 households to 6,000 households. The $15 million in my amendment will provide a little over 6 months of funding for those newly eligible households until their incomes can recover. And if $15 million proves too generous, which I very much doubt, the Secretary has authority to grant only as much as needed to respond to the disaster caused by Typhoon Mangkhut and Super Typhoon Yutu. I ask my colleagues for their support of my amendment and of H.R. 268, and I reserve the balance of my time.
The gentleman yields. Does a member claim time in opposition to the amendment? The gentleman from Northern Marianas.
Madam Chair, again, because the Marianas is not part of SNAP, there is no contingency funding to absorb the cost of this disaster. With more families eligible for assistance, unless we make more funds available, benefits will have to be cut across the board. This is not a right way to respond when people are trying to put their lives back together so they can support themselves and their families again. I ask my colleagues to support my amendment making another $15 million available so these families have enough food. I urge your support for the underlying bill as well, and I yield the balance of my time.
The gentleman yields. The question is on the amendment offered by the gentleman from the Northern Mariana Islands. Those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to.